Yeah, I'm absolutely delighted to be here because my PhD was funded by the HRB, so I was thrilled when I got the call. I've spent about the last 12 years working in healthcare as a management consultant, and one of the things that I spent a lot of time on has been how you deliver new models of care that are not focused on hospitals, so that are focused on the out of hospital for some of the conditions that are a real challenge to our populations at the moment. So people who are aging, people who have long-term conditions. So that shift from, the traditional acute illness, we treat an acute illness, you come to us and we'll treat you, to actually having to manage things in a much more long-term way. And actually, big data and access to electronic health records is a key enabler of that, and you'll see that reflected in the presentation. Before I go into the presentation, one of the thoughts that I always have about this is, you've heard a lot today from Anya, from others, about how big data is revolutionizing the world that we live in, revolutionizing business. It's enabling athletes to, achieve peak performance that we could never have imagined in the past. It's, for banks and governments, indeed, it means that people can identify fraud and save money. It means that airlines can operate with, previously unimaginable safety records. So it's had a massive impact on a huge number of industries across the world. And you would imagine that in healthcare, it could actually transform, the way that we do healthcare, the way that we treat patients. But healthcare really hasn't changed. If you think about how you access healthcare today, it's really not that different from how it was 20 years ago, except for the fact that there might be a computer in your GP's room instead of like a huge bunch of files, though that's not always the case, frankly. We still go to hospital when we get sick, and it's still quite a paternalistic environment in which you go to a doctor or a nurse and they treat you for the illness that you have. So why hasn't big data transformed healthcare today? Is a bit what I'm going to talk about, and some of the business reasons and others that sit behind that. And I think it's fair to say, and you'll have heard a lot of this morning, there have been amazing innovations if we think about what IBM Watson has done in terms of the ability to demonstrate what AI and machine learning can do in the neonatal ICU, for example, where you can predict on the basis of analysing massive amounts of data when a neonate who's at risk will crash a full 12 hours before the best doctors in the world can. So, there's huge sort of impact on some of the individual care that we're providing, but I think we're missing a massive trick in the fact that we can't actually use the huge amounts of population data that we have to actually predict what the health system will need to provide and what patients are going to need. And I'm going to talk a bit about that now. Because I think one of the big blockers we have is the lack of access to and the inability to use effectively patient-level data that we're gathering across the system. And when we talk about patient-level data, this is individual level records. It's not averaged out population data. This is individual records that we have for patients, which has detail about their demographics, the way in which people are living, detail about the kind of interactions they're having with the health system, their own health status, the drugs that they're taking. And the more that you can enrich this data with increasing amounts of data, either from the wearables that the patients have themselves or from sensors that they have in their home, the more that you can do with this data to really support that patient and also configure your health system in a way that can respond to the needs of patients as opposed to sort of just do what it's done for the past 100 years effectively. And I think the critical thing here is it doesn't have to be identifiable all the time, but it does have to link the data for single patients all the way through the system. All of this has to be linkable back to individual patients. And why is this so important? It's important for a number of different reasons. It's important because it can allow us to, economically actually facilitate large-scale public health programs. We can deliver a higher standard of care much more affordably than we're doing at the moment, and everyone knows, we hear it daily, the challenges that the healthcare system in Ireland is facing in terms of delivering affordable care, and that's not unique, right? Every health system in the world is facing the same challenges. And it can also allow us to configure that system much more effectively, so enabling us to predict responsive capacity planning within the system, in parts of the system, particularly, as we know, in A&E in Ireland, that get really hit hard. So what can we think about in terms of this? So what do we mean here? So first of all, we need to be able to look holistically at the population, understand their current and future needs, and then focus on targets-driven preventive medicine. And there's some really good examples of where people have done this. If you look at the Estonian healthcare system, it's probably the only healthcare system in the world, and you may have heard about this morning, which has a fully electronic health record for everyone in the population. Massive investment. They set out the policy in 2000 and finally delivered the health record in 2011. And it's had a huge cost, but the benefits are already beginning to be clear. They've run a big program around diabetes for all of the diabetics in the country, and it's had a significant and publishable effect on the outcomes around diabetes. Even more locally, I worked with a borough in London, a really poor borough, which had some of the lowest vaccination rates in the country for MMR, and they were seeing a massive spike in the admittance of children with measles into the hospital. There's huge cost associated with that, both in terms of the outcomes for those patients, kids ending up blind and things like that, but also in terms of the cost to the system. And they just took a very simple approach using what electronic healthcare records they had to actually target specifically the children that they knew needed vaccination. And they got to herd immunity within 6 months. Right? So as soon as you have healthcare identifiable data, you can have a massive impact on the public health of your population. And that's just the Estonia example. Delivering higher quality care affordably, this is the thing that I am most passionate about, to be honest with you, because there are so many examples where we see around the world where if you have access to patient data that's identifiable and that you can actually use to proactively manage health, that you can have a massive impact on the health of individuals, but also the health of your population or subpopulations within that. And this is really about designing more effective treatments and targeting it at those groups of patients, so particularly patients with long-term conditions or higher risk factors that they might be susceptible either genetically or because of their lifestyle to long-term conditions. And indeed, patients who are elderly. So what do you need? We need large data sets of past patient treatments and outcomes. We need the infrastructure to allow personalised plans. Typically, we have monitoring of adherence to protocol. This is a really big issue. And we need to engage patients to get involved in their own care. And this is a critical enabler of this. And I think we were talking this morning a bit about what's the changing role of doctors and patients in the world of big data. And that, for me, is one of the biggest challenges that we face. Because although I think there's a big sort of logistical challenge that we're talking about now in terms of actually having healthcare records, enabling the change in the way that care is delivered is going to really need huge mindset shifts from both patients and the professionals that I think are going to be really challenging. So what can this actually do? There's a great example from Mount Sinai, which is a healthcare provider in the US, and they have designed this preventable admissions care team, which uses a combination of the electronic health record for patients and innovations around the care model. So they're using the information that's coming out of the electronic health record to design a care model that means that patients do not go back into hospital after they've had an acute episode. And this is hugely valuable. It's hugely valuable to the system because having people in hospital is incredibly expensive. It's hugely valuable to patients because hospitals are where you're most likely to catch the nastiest bugs that exist in a system. And they are very disempowering, particularly for patients who are older. So once older patients go into hospital, it's incredibly difficult to get them back on their feet and living in their home in the way that they typically want to. So what happens here is you use the electronic health record to identify patients who are at high risk of admission. And again, the more data that you have in these records, the more effectively you can identify people. And then you have a transitional care protocol, and here the electronic health record is a critical enabler because this is not carried out in the hospital. So this is about the care that is provided to people in their homes through their primary care team, through a patient coordinator and navigator that calls them on an ongoing basis to check in and make sure they're getting the care that they need. And so it's really critical that not only do we have a health care record that will enable us to identify these patients in the first place, but also we have a record that can be shared across the system visibly with the patient so that you can actually manage care effectively. And that's one of the biggest challenges that we have with all of the information that we have in healthcare today, as I'm sure you know, that we just can't share it between the settings that exist. It's had a massive impact. You can see on the screen, it's had a massive impact. It's almost halved the number of hospitalizations, a huge reduction in the visits to A&E, huge reduction in 30-day readmissions, and 84% of patients kept their appointments because they were being sort of proactively managed through the system, through the care team that was put around them. So it can have a massive effect, and we see this over and over again where you have an electronic health record and you can use this as an enabler of designing a care model, particularly often for a group of patients who are very vulnerable or who are at risk, that you can dramatically improve both health outcomes and also have a very positive economic effect. So the last one then is just talking a bit about predictive and dynamic capacity planning. And I think this is really important. In Ireland, we know we're right in the middle of the winter, which is entirely unpredictable, of course, but we have winter now, and so we have the trolley crisis in A&E. And this is, sort of an annual issue which we face. So why can't we use the data that we have about the system to actually predict what we're going to need in terms of capacity and when? Why are we not doing this already? So really what we need here is effectively a set of information that can help us to predict what the demand is going to be within hospitals and configure the capacity. So we're not going to be able to build hospitals overnight, but we can at least know, you can make temporary changes to ensure that you have the right number of trolleys and you configure them in the right way so that you don't see some of the headlines that we have on an ongoing basis. So ideally what you would have is real-time information on patient flow. You would be able to allocate doctor workload. You'd be able to ensure that you were using doctors' time in the right way. And this is something, I think the example here from Spain shows. They have a fully digital electronic health record, and they use this not only to manage patients more effectively, so they've seen some really good outcomes for some of their diabetic patients and cardiovascular patients, but they also link it into the operating model and the operating system within the hospital itself. So the booking systems are fully digital. Real-time changes are reflected in the booking immediately, and there is a high degree of trust in the automated systems. And this is actually one of the biggest issues, I think, that exists with both big data and the digital world, is just the lack of trust that both patients have, but frankly, more importantly, clinicians. Often we find that lack of professional trust is one of the biggest barriers to delivering some of the changes that we talk about with big data and the electronic health record. But what they've done is really interesting. They sort of predict the saturation periods. They make sure that they schedule the right number of doctors. You would be amazed if you saw the cost associated with hiring locums, with hiring temporary and agency staff. It's a huge part of the cost in the health system today. And actually being able to, reschedule and reallocate workload in a flexible and in a timely way, and it would enable a huge cost reduction for the hospitals and health systems. So they've managed to make significant changes in terms of reducing the length of stay to 4.3 days compared to 6 days. Waiting times are much shorter, not unexpectedly, and costs are much lower, which means because it's a private system, they can actually pay their doctors more. So there is both an impact on the patient, but also a cost and economic benefit to the hospitals here. So why is it so difficult if there is a clear business case, in many cases, a clear economic benefit, and also a clear benefit to patients? Why are we not doing this? Why is it not happening? And I think there's probably 4 key issues here. The first is this issue around the perception that people are not willing to share their data or are nervous about what this might do. And that there is risk in data sharing to both institutions and individual professionals within the system. The reality that we've seen, and I know that Natalie has done some work about this, is actually patients can fairly easily be convinced to share their data if you present some of this to them, right? So they are not typically the barrier. There are significant regulatory burdens and there are real risks, and that is why actually institutions are often very unwilling to share their data, and as are clinicians within those institutions. The other challenge is there are really significant infrastructure gaps when it actually comes to the logistics of sharing data between systems within the healthcare. I think you heard about this morning, but it's really difficult to navigate the number. I've just listed the number of sort of legal documents that are involved in governing the sharing of data. It's really hard to navigate this. If you look at what they've done in the UK, and it's not perfect, but they have a set of Caldecott principles which actually make it much easier to share data. Now again, they are still not ahead of the curve, but I think sort of having those set of guiding principles has made it a lot easier for people at least to understand what their rights are, where the accountability sits and what they can do. I think it's really important to recognise that these risks do exist, because actually there have been cases taken against institutions in terms of sharing data when patients weren't aware of it. So this is the case of a patient tending an A&E department. She was contacted by researchers later who were working as part of that A&E department. She had no idea that her data had been shared as part of that, and she successfully sued the institution. So people are reluctant because of cases like this, and I think we need to get really clear on what are the protections that are needed for institutions in order to be able to use data effectively, and how are we going to, as a country, frankly, put in place a regulatory framework that will enable us to both protect the rights of citizens, but also give them the benefits that we can see from this. I think the other challenge, which I haven't got up here, but it's a really significant one, is it's actually really costly to put in place an electronic healthcare record. And it's not easy, right? And it takes a huge amount of time, right? So if we look at the Estonia example, it was very costly. It took them 11 years from actually deciding that they wanted to do it to launching a working healthcare record. They're only now beginning to see benefits that are in any way quantifiable for patients, right? Now, they've digitized their whole public service, and they've shown lots of benefits in terms of cost as they've gone through that. So they are fully committed to it. But it was a very expensive undertaking, and it was long outside the sort of political timelines that we face today. And so one of the key things that's important here is the ability, the investment that you make in this, the commitment of the investment that you make in that, and the commitment to stay the long term, right? So we now have some successful examples of electronic health records, but we also have some spectacular examples of failures, not just here, but across the world. So it's going to take real commitment and real money actually to make this happen. I think one of the other challenges is, in terms of making the business case, is that actually the benefits don't necessarily accrue to the people who invest, right? So the benefits sort of accrue at different parts of the system. I think the overwhelming reason to do this, however, is just that my personal belief is that the sort of use of big data in healthcare combined with the use of digitization is the way that we're going to unlock the sort of next horizon in terms of lifespan and quality of life, which is exactly what you were talking about. So how do we make sure that people live not just longer lives, but also healthier lives? So what do I think we're going to need to do that? Well, we started talking about this a little bit. We need national leadership. We really need national leadership if we want to unlock the benefits through the development of a healthcare record. We need to communicate to people and engage them in why this is a good thing to do. And we also need to invest significantly behind that. And we need to put in place the right kind of regulatory framework that's going to support it. There's a lot that we can do with the data that we have right now. So what are the quick wins that we can use to demonstrate to the system? Because as I was saying, this is not just about sort of, putting in place an electronic healthcare record and investing behind it. It's also about changing fundamentally the way in which we use information. There was a lot of talk about this morning, how doctors interact with patients, which historically was sort of based on this dissymmetry of information, where doctors had all the information about what your symptoms meant. That doesn't exist anymore. We all go on Google before we go to the doctor. So it's not what the role of professionals within the system needs to fundamentally change if we're going to actually deliver this. So what can we do to actually demonstrate the quick wins? AI supporting diagnostics, the kind of triage algorithms that will help us to manage our A&Es more effectively. And then actually committing to and implementing a medium and a longer term strategy around digitization and data integration, and providing the kind of data governance and stewardship that's going to enable us to do this in a way that protects the rights of patients, but also protects the professionals and institutions. And then continually refine this, integrate it with things like sensors, make sure that we're learning from and using the data really effectively to unlock the potential that I think is huge across the system in terms of big data for healthcare. I will finish there.